Hello, my name is Dr. Tim Picell. I'm Assistant Professor of Physician Assistant Studies at Presbyterian College in South Carolina. I'm going to present today a discussion of the medical aspects of the crucifixion of Jesus. Just to start, I'd like to talk about what you should expect from the presentation. The presentation is not a complete history. This is not designed to be a history lesson. I'm a medical professional and not a historian. Some of you probably are much better versed in history than I, but I do have historical references here, all of which are referenced at the end of the presentation. It's not a discussion about truth or reality. The truth is in the eye of the beholder, as the old saying goes, and this is not a discussion of what is true or what was real, but simply a discussion about the medical aspects of torture, crucifixion in particular, and the death of Jesus. It's not a dissection of the interpretation of Greek and Hebrew translations of the Bible. I have chosen a translation. By no means do I think that it is the only translation. There are many out there, but from the one that I chose it just to simplify the understanding. It is a modern English translation of the Bible. If you prefer King James or the Douay-Rheims Catholic version, certainly that is up to you. But I chose this one simply to illustrate in plain language the aspects of the crucifixion that possibly took place. I don't mean for this to be a religious debate. I'm not debating whether the crucifixion actually happened, whether Christ is the Savior of the world, or any of those things. This is simply a discussion about the medical aspects of what might have happened to Jesus. Were the references that I chose actually true? It's not really to propose a theory of a final cause of death for Jesus. There are many, and we'll discuss some of those today, but I do not believe that it was any one singular cause. And we'll talk about that as we move forward. The presentation is about medical aspects of the events surrounding the Passion of Jesus. It's from the aspects of the Gospels and secular history. So I haven't chosen one or the other, but yet a blend of those resources. And also wanted to cover other aspects other than the physical aspects. We'll talk about emotional and mental aspects, as well as the physiologic processes that may have happened as a result of the torture and trauma and injury. And finally, I will talk about many different things. Some of the Gospels may center on a particular set of topics. They may center on particular things that happened, and some of the others may center on other things that happened to Jesus while he was on the cross. I talked about all of those here. I don't mean to suppose or propose to you that all of these things actually happened. Rather, the theme will be that if something happened, if this event happened, if this torture happened, that this could likely be a physiologic outcome of that torture. So the topics that we'll cover today include a description and a history of the crucifixion. History is in lower, smaller font on purpose. We'll not emphasize the history of crucifixion. There are some things I couldn't avoid for the completeness of the presentation, but I'm not here today to propose a complete history of crucifixion. We'll talk about the Passion, and as I define it for the purposes of this presentation, it'll be from the Garden of Gethsemane through the actual crucifixion on the cross. We'll talk about what might have happened during the trial, during the scourging that followed the trial, Jesus carrying the cross, and then finally the crucifixion. Specifically, we will not talk about the resurrection. In my opinion, as a man of faith and as a clinician, the resurrection is something outside the scope of medicine and anything that we can define today in terms of medical aspects of Jesus' life. So let's start with a little bit of background. So if you talk about any type of traumatic death, One of the ones that comes to mind is beheading. And if you think about beheading, there are some famous historical figures who were beheaded. For instance, Marie Antoinette and Louis XVI, Anne Boleyn, St. Paul the Apostle. And then this historical figure is William Wallace. And if you don't know who William Wallace is, this picture of Braveheart and Mel Gibson might refresh your memory. So the point being that there is not one figure in history, if you say beheading, that it becomes a single individual that represents that type of death. The same can be said for assassination. Archduke Franz Ferdinand was said whose assassination was said to have started World War I. Abraham Lincoln, of course, Jack Kennedy, and Martin Luther King were all assassinated. But if you talk about crucifixion, there historically is only one that comes to mind, although thousands and thousands and thousands of people were crucified. The one crucifixion that comes to mind is that of Jesus Christ. It is so important to Christian traditions that the instrument of death has become the religious icon. There's nowhere else in history of religion where the martyrdom of the central figure of the religion is exemplified by an instrument of torture, which is a cross. According to Martin Hengel, who was a German religious historian, the crucifixion of Jesus is an utterly unique event without parallel in the history of religion. So let's talk about the Passion. We'll talk about Gethsemane, the trial, scourging, the walk to Golgotha, and the crucifixion. So we'll start with a little bit of background on Jesus' physical health. So by many accounts, Jesus was a relatively young man. Some say in his early 30s. He led a meager lifestyle, son of a carpenter. I guess one could say he ate organic. At that time, there was not really much of a choice. He walked everywhere. There was not a lot of transportation, certainly no public transportation, no cars, no other modes of transportation other than riding, perhaps riding donkeys or horses. But generally speaking, he walked everywhere. So it could be said that he was in relatively good health, physically. Let's talk about psychological health. There's a condition known as death row syndrome that is common among death row inmates. I should say that it occurs among death row inmates. It's not very common, but it does occur among death row inmates, and the symptoms are profound anxiety, the reason being that to know the time and place of one's own death, it proves to be a terrible psychological burden. That translates into physiologic problems such as profuse sweating, palpitations in the chest, rapid heart rate, elevations in blood pressure, and severe anxiety, insomnia. We'll talk about how Jesus suffered a constant taunting and mocking, and it's a recurrent theme throughout the presentation. You'll see those things in bold throughout the presentation as we talk about that. There's some evidence that Jesus may have felt some of these things, this incredible weight of the task he had undertaken. One is that he mentioned, take this cup from me. When he was in the Garden of Gethsemane, he said, take this cup, shortly followed by, not my will but thine, as he talked to God. And then at the end, why have you forsaken me? So these things, even though Jesus knew from the beginning what his task was, these are evidences that, to me, show that he was still, from the beginning to the end, struggling with this heavy burden. So let's talk about the definition of the Passion. So Latin translation, passion means suffering. For the purposes of this discussion, we're going to talk about the time between the Garden at Gethsemane to Calvary. One of the things you'll note is that each gospel has slightly different emphases. I won't say that they're different versions, but there are different approaches to the story of the Passion, and we'll see references as we go through the presentation. The discussion is summative. Again, I'll be taking parts from all the Gospels plus items from secular history to talk about. Again, the theme is that if this happened, if this particular torture happened, or this particular part of the torture happened, this is what he may have felt, or what anyone who was crucified may have felt. Start with the garden at Gethsemane. And being in anguish, he prayed more earnestly, and his sweat was like drops of blood falling to the ground, from Luke 22:4. So this condition, hematidrosis, hemohydrosis, I think possibly there are more names for this condition than actual cases in history. But you can see that in times of severe emotional distress, that the body, the capillaries or small blood vessels in the body will actually leak blood into the sweat glands. And so this causes a bloody discoloration of the sweat. It's an extremely rare condition, although I did find an article with 76 cases reported. Most likely this condition is not fatal. However, blood is an irritant, and whenever it is outside the vasculature, it does create pain, discomfort, inflammation, because it's irritating to the tissues. So it probably was quite painful. Moving on, we'll talk about the trial. Then the governor's soldiers took Jesus into the praetorium and gathered the whole company of soldiers around him. They stripped him and put a scarlet robe on him, and then twisted together a crown of thorns and set it on his head. They put a staff in his right hand. Then they knelt in front of him and mocked him. "Hail, King of the Jews," they said. I added emphasis here to see you can, again, remember that the emphasis is all the mocking and the shame that was accompanying the cross. And we'll talk about the shame and crucifixion and how that was an important part of the task of crucifixion and the goal of what crucifixion was supposed to be to the Romans. And then twisted together a crown of thorns and set it on his head, from Matthew 27. So this is the plant that was originally called the crown of thorns. So this is the commonly known crown of thorns plant. It was originally thought that it may be the plant that was used to create Christ's crown of thorns. However, this plant grows in Madagascar, not in the area where Jesus was crucified. This is more likely the plant that was used for crucifixion, crown of thorns. It is indigenous to the area where Christ was crucified. And you can see that the thorns here are about 1 centimeter long, half an inch. And this would be something that the crown of thorns that Christ wore would probably have been made of. Here you can see a common depiction of what the classical crown of thorns may look like. This plant is not indigenous to the area where Christ was crucified. It is impressive, but probably not realistic. Some of the research that I have done showed that the plant, the crown of thorns, may have actually been more like a helmet rather than an actual ring. So this would have been important because it would have created much more trauma to the head. As you'll see when we discuss later, Christ was beaten about the head while wearing the crown of thorns, and so a crown arranged like this one with the half-inch thorns would have created much more damage to the scalp, which is an incredibly vascular area, very thick, full of blood, and so would have created a tremendous amount of bleeding and lacerations, puncture wounds to the scalp. Here's an artist's rendition of what the actual crown of thorns may have looked like if it were shaped like a helmet that we discussed. The men who were guarding Jesus began mocking and beating him. They blindfolded him and demanded, "Prophesy, who hit you?" And they said many other insulting things to him. So from Luke, you see here again the recurrent theme of mocking and belittling and insulting that accompanied. But also note the beating that occurred. from Matthew, they spit on him, and they took a staff and struck him on the head again and again. Now this becomes important because of the crown of thorns that we discussed earlier. And had this thorn helmet been the actual structure of the crown of thorns, then it probably would have caused much more damage. Those thorns are approximately a half an inch to an inch each on that plant. And so these thorns would have been driven in like nails into the scalp, which is a very thick vascular area. So it probably would have caused a lot of pain, a lot of bleeding from beating someone on the head that had a structure like this on his head. Then Pilate took Jesus and had him flogged. This seems like a very direct, simple statement, and possibly even overlooked in John if you don't pay attention. However, flogging was not something that was taken lightly by the Romans, and as you'll see, is something that's absolutely devastating to the body. So flogging is also known as scourging. We're not sure exactly what a flagrum looked like. This is one recreation of what a flagrum might have been. So another name for a flagrum is a cat of nine tails. Although they didn't always have 9 ends or 9 projections like you see here, they may have had anywhere from 3 to 12. But one of the reasons they're difficult to know exactly what they look like is, as you can see, they're made largely out of leather, wood, rope, and those types of things would have all degraded, of course. So at best you may have found these metal ends that are here present on this rendition of a flagrum. Sometimes it was sheep bone, sometimes it was metal weights or blades like you see here. And here is another rendition of what a flagrum may have looked like. So in addition to the beating, the first thing that happened often is that the victim was stripped naked. So completely naked. This added to the shame, added to the psychological torture that accompanied the scourging. The victim was typically bound to a short or tall post, and we'll talk about that in a little while. The lashes were administered often by 2 men called lictores, who would administer the lashes, often a Roman guard or Roman centurion or soldier that was responsible for administering these lashes. Interestingly, I found references that while most of the time you see these only on the back, up to a third of these references, or up to a third of these lashes could have been administered to the front of the body. So a lot more painful probably on the front of the body. Nerve endings tend to be on the ventral aspect of the body and in higher concentration. So there is probable extensive pain with lashes that occurred on the front. Plus there risk of hitting the face, the genitals, other things like that when you're lashing to the front of the body. And the goal was severe weakening, deep wounding, bleeding, and again, as we discussed, shame. The soldiers tied the victim, again, mostly naked, to the post, either an upright or a bent position. You can see here a bent position on a short post and 2 lictores administering the lashes with the flagrum. In the insert of the picture, you can see that the flagrum has either metal or bone attached to the end to open up wounds and deep gashes into the skin and eventually probably into the muscle as well. Again, another rendition here from Edwards that shows a proposition of what a flagrum may have looked like, as well as the description of the scourging on a tall post administered by 2 Roman guards, and then you can see also the directions of the whip marks from the flagrum. The Jewish tradition held that 40 lashes was considered the maximum prescribed by Jewish law. It was a limit for a punishment. There were situations where death from scourging was prescribed, and of course there would be no limit at that time. However, typically, unless death was prescribed, the number was back down from 40 to 39. As I said, in many cases, the scourging was fatal, even lower than the maximum number of 39 to 40. However, if a lictore caused death by going over the prescribed number of lashes, then often it was recorded that the lictore himself could be put to death by scourging. So they were obviously very concerned about making sure the number was correct. If the victim died during the scourging, but the maximum number prescribed by the governor or whoever prescribed the torture was not reached, then it was not considered the fault of the lictore, and so the lictore would escape any punishment there. But because of the severity of the nature of the scourging, and also the condition of the victims prior to the scourging, many of them died before the final number was reached. Here you can see a depiction of what 10 lashes might look like. And remember, Jesus more than likely received around 39 to 40 of these lashes. While this is certainly a disturbing photo and very indicative, I don't believe that it is completely accurate because of what I described previously about how the lashes were administered. You can see the length of these lashes, and this depiction was from a cat of nine tails, because there are 9 lashes for each one of these large groups. I don't believe the length is accurate. They probably would have been much shorter, because I don't think the entire length of the body would have been covered by 1 lash. However, I don't think that detracts from what may have happened even if it was a shorter lash. So even a lash a third as long as these, especially if concentrated centrally on the body, would have produced deep gashes, deep wounds, bruising, trauma to the tissues, and been certainly a devastating wounds. Again, the metal balls created deep bruising or contusions in the body and crushed the muscle. Whenever the muscle is crushed, it releases a lot of toxic things into the bloodstream we'll talk about soon. The metal or bone shards would lacerate the tissues and create deep wounds through the skin, through the subcutaneous tissue, and also even into the muscle and perhaps bone. Significant blood loss was a problem. It causes low blood pressure so that the victim may not even be able to stand, and even leading to hypovolemic shock, where blood loss caused the patient or the individual victim to go into shock. The tissue damage released large proteins into the bloodstream that caused the kidneys to possibly go into acute renal failure. And this is called rhabdomyolysis, where muscle breaks down from trauma and releases these large proteins that are filtered out by the kidneys. But the kidneys literally become stopped up with these large proteins and can't function, and this just causes renal failure. So after the scourging, the top part of the cross that you see where Jesus' hands are nailed in the bottom right corner of the picture, the top part is called the patibulum, the horizontal piece of the cross, and it was tied to the victim, and then that was typically how it was carried to the site of the crucifixion. Unlike a lot of depictions now, I don't believe that Christ actually carried the entire cross. There's nowhere is a reference that he carried the entire cross, and the common occurrence was to have the upright piece or the stipes planted in the ground and used over and over. So we'll talk about that a little more as we go. A person walked in front of the condemned and carried a sign called the titulus, and the titulus is depicted above Jesus' head in the picture noted here. More than likely, it would say something like Jesus of Nazareth, King of the Jews, or have his crimes listed on the titulus. And so when that was carried ahead of him as he walked through, another instance of inciting mockery in the crowd. Remember that this patibulum was carried, it weighed anywhere from 75 to 125 pounds, and it was bare wood across open flesh, down to even the level, as we talked about, of muscle or bone. So remember also that the woodworking instruments were not fine instruments that we have today. They were rough cut lumber. And so this would have been grating and grinding across open wounds of flesh across the neck and back and its back of the head, possibly even lying on the crown of thorns as it pushed it into Jesus' head even more. Here you can see the parts of the Latin or tau cross. If you look at the bottom right corner, there are the two most common shapes of a cross for the time. The leftmost picture is a T-shaped or a tau cross, and then the right hand is the typical Latin cross. Above you can see the titulus with the information inscribed there, and then to the left you see the patibulum strapped to the upper shoulders and upper back, and was carried in this fashion most often. Let's talk about the walk to Golgotha. So now we'll discuss the trauma that possibly occurred on the walk. The patibulum, as we discussed, is the top of the cross, and it's a heavy piece of wood, 75 to 125 pounds. If Jesus fell with this across his neck and back, and his hands were tied to it, it would have been difficult at best to break a fall. He would have had to, at best, turn one hand or the other to try to lessen the fall, but it's also quite likely that the falls were not broken by anything. So one would experience significant facial trauma, head trauma, neck trauma, and particularly chest wall trauma, because the chest wall would be what hit the ground first with that 125-pound weight strapped across your back. The chest trauma more than likely would cause significant bruising of the heart. It also could cause a collection of fluid around the heart called a pericardial effusion, and we'll talk about that in a little while. A collection of blood inside the chest wall, outside the lung, is called a hemothorax, and that's caused from bleeding or disruption of the blood vessels, and a collection of a pocket of blood inside the chest would have decreased his ability to breathe and take a full deep breath. And then finally, also, pulmonary contusion is a contusion of the actual lung tissue, and that's a bruising. And so when you have a bruising, that simply means it's a collection of blood inside the lung tissue. That would have made the lung tissue function poorly, if at all. So in addition to all these other things, probably would have had difficulty breathing secondary to bruising of the lungs. So we'll talk about the heart. If you look at this diagram, you see this pericardium. It is a thick fibrous tissue that surrounds the heart, and it's a small amount of lubricant inside that sac that allows the heart to beat and to move without friction inside that sac. However, if you have a buildup of fluid or a pericardial effusion, then the fluid starts to put pressure on the heart, and that becomes a problem when the heart tries to fill with blood. So during the relaxation phase of the heart is filling with blood so it can continue to pump blood at the same volume and same rate around the body. And this would have been severely compromised had the victim had a pericardial effusion. Let's talk a little bit about the theories of death and what happened to heart. One of the theories is that the heart ruptured. Well, if you look at this diagram of the heart, if you look in the bottom right corner, you see a sign that points to ventricular septum. And if you look around that sort of U-shaped area around the outside of the heart, you can see that septum and around the outside of the heart is very thick muscle. So it probably would have been requiring forces that were too significant even for a fall of that nature with a weight strapped to your back. The forces would not have been enough to rupture that part of the heart. If you look at the blue areas on the right side of the heart, RA is the atrium, RV is the ventricle. The ventricles are strong and thick-walled muscle. The atria are a little bit weaker. The RA is the right atrium, left A is the left atrium, and they're a little bit thinner, but still more than likely would not have had enough force to generate that would cause a rupture of that heart muscle. What likely might have happened is that if you look at the valves in the heart, if you look between RA and RV, you'll see the tricuspid valve. There's the valve that keeps the blood in the heart from flowing backwards. And this blood, this valve leaves are attached to the right ventricle by what's called a chordae tendineae. Now, if those chordae tendineae ruptured, then what happens is the valve between RA and RV goes backwards. And instead of going from RA, the right atrium, to the right ventricle, then the blood would also flow backwards through the right atrium and back into the body. Now, the blue blood is deoxygenated blood, so it does not have oxygen. It's already been depleted by the body. And so this unoxygenated blood is building up in the body. It also decreases the amount of blood that's pumped over from the right ventricle, follow the arrow up to the PA, or the pulmonary artery. And so it decreases the blood that goes to the lung to be oxygenated. Also, if the mitral valve on the left side of the heart were ruptured, then instead of going from the left atrium to the left ventricle and through the aorta, the blood would go backwards into the pulmonary veins of the lung. So the ventricle on the left side, LV, would be pumping blood backward into the lungs also. So the oxygenated blood would be remaining in the lungs. This would create a backlog of blood in the lungs, would create edema, pulmonary swelling in the lungs, and made it all that more difficult to breathe. Now let's talk about the actual crucifixion. According to Mark, it was 9 in the morning when they crucified him, and about 3 in the afternoon when he cried out and was near death, from Matthew 27. So that total time was about 6 hours on the cross, if you take that as a literal translation. What is crucifixion? So most authors, historians agree that crucifixion is probably one of the most shameful, scandalous, painful, degrading deaths ever conceived. The Romans used it extensively as a method of social control, meaning that they used it for rebellions, specifically for individuals who sought to overthrow or subvert the government. If you think about the term excruciating, which you may have heard, literally excruciating means from the cross, if literally translated. Again, you see here the emphasis on degrading treatment from what the definition of crucifixion is. Crucifixion was absolute, undeniable torture from beginning to end. Cicero was one of the greatest orators in the Roman Republic and consul to the emperor in 63 BC. He once said that it was inappropriate for the word cross to even be used in the presence of a Roman. It was such an offensive term that it was improper to even use the term in the presence of a Roman. And he also said that of all punishments, it is the most cruel and most terrifying. Crucifixion probably originated with the Assyrians and Babylonians, but really became systematic with the Persian Empire, and was introduced to Rome in the 3rd century by the Carthaginians during the Punic War. Rome obviously adopted the practice and perfected it with frequent use. Specifically in the Spartacus Rebellion, the infamous road from Capua to Rome, where it is believed that approximately 6,000 people were crucified on that road. Typically, crucifixion was reserved for the lowest of society, including revolutionaries, the worst criminals in the Roman Empire, and Christians. The practice of crucifixion did survive to modern times, and you can see here a reenactment from a 1919 documentary. This is not an actual photo, but one from the documentary that was based on eyewitness accounts of Armenian genocide that included this depiction, which was crucifixion of young Armenian girls by extremists. And then here you see depiction of 3 Catholic priests who were crucified at Dachau concentration camp in Germany during World War II. 2 of them are hanging from the tree, and then the third you can see at the foot of the German soldier. Again, crucifixion is a deliberately slow death by torture. It was conceived to cause the utmost suffering and typically lasted about 24 to 36 hours, although some, depending on their physical health and other factors, may have lasted much longer. Here are the variations used in the cross. We're not going to go through these. They're all basically for the same purpose, but there were many different types of crosses used. We've reinforced throughout the presentation that shame was as big a part of crucifixion as the torture. However, also maiming was often part of the process. The maiming could include anything from excision of the tongue to a traumatic blinding and even impaling of genitals. However, one of the worst in history was Antiochus IV, who was noted for a specifically cruel version of his crucifixions. The crucifixion that he oversaw involved having the young children of any of the crucifixion victims murdered and then hung around the crucifixion victim's neck as he would walk to the crucifixion and be crucified. Let's talk now a little bit about the medical physical aspects of crucifixion, particularly the hands and feet, and then the spear in the side at the end. The hands have a very weak musculature, and the soft tissue between the fingers is not very strong. You can see here in this graphic that the small muscles called the lumbricals are between the fingers and the metacarpals. The bones are oriented along the long axis of the arm, so should a nail be placed in the center of the hand, it would more than likely pull through. The wrist bones are oriented much differently, as you'll see in a moment, and there's a much stronger retinaculum that is that fibrous tissue that goes across the wrist you see here. Here is a depiction of the wrist bone. So if you look at the bones on the left of the wrist compared to those of the hand, you'll see that the odd-shaped bones of the wrist have much more a much different shape. And if you look even closer to the arm, you'll see the 2 bones there, the radius and the ulna. So many theories are that the actual nails went through the hands, went through the wrists, or went through the distal forearm where these 2 bones on the left hand separate. If you look at the right hand picture, you'll see that large band of retinaculum that I talked about, very thick fibrous tissue. It probably would have withstood a significant amount of weight. So speaking of weight, I worked through these problems with one of our physics professors here at Presbyterian College, and suffice it to say that he convinced me of something that I had heard but was doubtful of. So working through the math, this is the typical presentation of what you might see as a crucifixion, and the angle that the arms occupy is about 30 degrees. So anywhere between 30 degrees and a smaller angle, which would have meant that the body was higher on the cross. If you do the math that I described earlier and look at these angles, Jesus bore the full body weight on each of his hands. Now, most people would assume that the body weight would be evenly split, but again, I was skeptical of what I had heard in some of the research that that the full body weight was borne by each hand, but this math that we worked out with the angle descriptions and the forces proves that the full body weight of Jesus would have been borne on each hand. In looking at the hand, the spikes that were used on the left were probably 5 to 7 inches, and if an adult male, it would have gone from the tip of the long finger to the base of the wrist. So that's about how long those spikes would have been, and about as wide as the small finger. And you see here the middle picture with this spike placed in the wrist through that retinaculum and down between the bones of the end of the forearm there. There is some discrepancy about whether it went further toward the hand or not, but either of those two places would have been a much more likely place to have placed the spikes than in the actual hand. Talking about the feet, the case is actually the opposite. If you look at the top right picture, you see that between the second and third metatarsal would have been an ideal placement, because you look at the top picture where it shows the side view of the foot, you see that the weight-bearing direction is downward as opposed to at the end of the hand, it is at the base of the foot. So it was likely that both feet were placed one on top of another and nailed, as you see here, directly to the post. That spike would have gone through several deep arteries. It would have also gone through several nerves, so every movement would have created significant shocks of pain that went down to the toes and up through the hips. In talking further about the feet, often in presentations of the cross you'll see this block that is below the feet called the subpedanium. Most of the research I found showed that it was actually rare to have the subpedanium there, and when it happened in later times after the death of Jesus. So this was probably not something that was around during the time of Jesus. As we move on, we'll now look at the sole piece of evidence for crucifixion that's been found. So this is an actual heel bone of a crucifixion victim, and if you look at the spike goes from the outside of the heel in through to the middle aspect of the heel and then into the wood. You can see that the end of the nail is bent, probably from hitting a hard piece of wood or a knot in the wood or something of that nature. And as we'll mention a little later, on the other side where the head of the nail is, around the head was found bits of olive wood in this particular specimen. And again, it's been the only one that's actually been discovered of an actual crucifixion victim. So this is the casket of the victim, in which the bones of this victim and a small child were found, but also this heel bone that had this nail. So many people ask, why is there so little evidence of crucifixion? Some people don't even believe that crucifixion happened because there's so little evidence. It makes very good sense that there was little evidence found because of what I said earlier about the type of people who were typically crucified. They were reviled people in the Roman society. They were the lowest individuals. They were criminals and Christians who were hated. They were usurpers and revolutionaries, again, who were hated by the Roman emperor. And often part of the continued shame and degradation was that these bodies were allowed to be eaten by animals, both hanging on the cross and after they were removed from the cross. So it is not surprising to me that there's very little evidence. This individual was actually buried in a crypt, as you see here. And like I mentioned before, the nail went from the outside of the foot into the post and through the middle of the post, and it went from outside to inside. And if you see that wooden wedge on the outside, it would have been likely that this was the way the crucifixion of the feet happened in that particular individual. And the wooden wedge was placed there to make sure that the foot didn't pull out through the nail head over the nail head. So it was placed there to make sure the foot stayed in place, and it would have presented something like this picture you see here on the right. So let's move on now and talk about the respiratory cycle. If you look at these diagrams, the diagram on the left is that of inspiration. Inspiration is an active motion, so it requires effort. The effort that's required is in two parts. So first, the diaphragm, which is the red dome-shaped object on the left, is in a contracted mode. So it's a dome shape, but when it contracts, it flattens out and pulls air into the lungs as it pulls the lungs down. Additionally, you can't see it very well here, but the intercostal muscles, or the muscles that are in between the ribs, as well as the anterior chest muscles, contract, and they pull the chest wall up. So two parts, the chest wall moves up, the diaphragm moves down. That's inspiration. On the right hand picture, you see that the chest is much more compressed. The diaphragm is elevated because it's in a relaxed position, and the chest wall is actually thinner. It is actually, the front of the chest has moved down. As you can note, if you look at the collarbones on the two images, they're in different positions, and the number of vertebrae that are seen in the neck, there's 3 on the right and 2 on the left because of the decrease in the chest wall. So the diaphragm has moved up into a relaxed position, and the chest wall has moved down into a relaxed position, and that's exhalation. The problem with crucifixion is that while exhalation is normally a passive process, in crucifixion it becomes an active process because the arms are being pulled up and away from the chest. So this creates active expiration. It's easy to fill up the lungs, but it's difficult to expel the air from the lungs in the crucified victim. At the end of the crucifixion and passion, there was mention of the use of a spear. Now it was the day of preparation, and the next day was to be a special Sabbath. Because the Jewish leaders did not want the bodies left on the crosses during the Sabbath, they asked Pilate to have the legs broken and the bodies taken down. The soldiers therefore came and broke the legs of the first man who had been crucified with Jesus, and then those of the other. But when they came to Jesus and found that he was already dead, they did not break his legs. Instead, one of the soldiers pierced Jesus' side with a spear, bringing a sudden flow of blood and water. There are a lot of questions about what the flow of blood and water may have been. If you look at this depiction, you see that the puncture through the right side of the chest would have entered the right side of the heart. This was a typical practice for the end of a crucifixion, just as breaking the legs would be. So in piercing, if you recall from the first part of the discussion, there may have been what's called a hemothorax, which is a collection of blood anterior or to the front of the heart. So there may have been blood there. If you look at the pericardium, there may have been collection of blood collection of fluid that would have been sort of a clear yellowish fluid between the heart and the pericardium. So the pericardial effusion we talked about. And then if you look at the very tip of the spear, the procedure was designed to pierce the right side of the heart. So if indeed they did pierce the right side of the heart, then obviously the blood flow would have taken place outside the heart through the pericardium. All the fluid would have flowed out. All the blood from the hemothorax, all this would have flowed out through that single hole, which would have been the only exit. So it does make sense from a medical perspective, the possibility that blood and quote-unquote water flowed from the chest. Finally, here you'll see some of the research throughout history of proposals for the death of Jesus. Personally, I don't believe that any one cause can be to blame, although asphyxia has fallen out of favor since Barbet in the 60s. I do believe it played a significant part in compromise at the end. It makes sense that the respiratory cycle would have been disrupted by hanging on the cross. And also, if respiration was not a significant part, I don't know why it would make sense for the practice to have been carried on so long for breaking of the legs at the end of crucifixion in order to hasten the crucifixion. Because what the breaking of the legs did was to allow the full body weight to hang from the arms without any respite. that would point directly toward respiration being a potential cause. In conclusion, crucifixion is likely one of the most horrific deaths in the history of humankind. The death of Jesus was likely multifactorial, but did include a component of asphyxiation. There was significant injury from the crown of thorns, from the scourging, and potentially from falls during the walk to Golgotha. Finally, the blood loss and fatigue, as well as the interruption in the respiratory cycle, likely contributed to his ultimate demise on the cross. Thank you for your time and attention to this presentation.